Cardiac review. We look at the function of the heart and the cardiovascular system. Pumps blood to the tissues to supply oxygen and nutrients, removes carbon dioxide and metabolic waste. The cardiac cells have unique properties. Automaticity, the cells contract independently. They initiate their own impulse. Excitability is an ion shift. Conductivity transmits impulses to another cardiac cell. Contractility is how well the cell contracts. The blood is supplied to the myocardium branches, the left main coronary artery, the left anterior descending, circumflex, right coronary artery, and distal right coronary artery. The cardiac muscle contractions last roughly 10 times longer than those of skeletal muscle fibers. The pacemaker with the fastest rate of depolarization stimulates the action potential. The SA node is 60 to 100 beats, the upper right atrium, and the AV node is 40 to 60, the lower right atrium, and the other pacemakers of the heart are less than 40. 5 areas for listening to the heart. On the right second intercostal space is the aortic, the left second intercostal space is the pulmonic, the Erb's point, where you hear the S1 and S2, is the left third intercostal space, the tricuspid, lower left sternal border, the fourth intercostal space, and then the mitral, the left fifth intercostal, medial to the midclavicular line. The pericardium, pericardial sac protect the heart from trauma. Serous blood lubricates and prevents friction, prevents the heart from overfilling. The heart is divided into 2 sides, the right and the left. All blood returns to the heart through the atria, and all blood leaves the heart from the ventricles. The cardiac blood flow, the way to remember, is tricuspid pulmonic mitral aorta and its tissue paper myocytes. Right-sided heart failure, think right retention. Patient can experience fatigue, increased peripheral venous pressure, ascites, enlarged liver and spleen, may be secondary to chronic pulmonary problems, distended jugular veins, anorexia and complaints of GI distress, weight gain, and dependent edema. Left-sided heart failure, think left lung, like paroxysmal nocturnal dyspnea, elevated pulmonary capillary wedge pressure, pulmonary congestion such as cough, crackles, wheezes, blood-tinged sputum, tachypnea. Patient could be restless, confused, orthopnic, tachycardic, exertional dyspnea, fatigue, and cyanosis. There's a disruption in the serum electrolytes can result in alteration in the cardiac cycle. An increased potassium and decreased calcium and decreased mag can lead to dysrhythmias and weakness. Increased calcium leads to increased strength of contraction. Decreased sodium leads to general weakness and less sodium to initiate action potential. Looking at with the electrolytes, hypokalemia, you would see a long QU interval or a prominent U wave. Hyperkalemia, a peaked T wave. Hypocalcemia, QT prolongation, and hypercalcemia, shortening of the ST segment. Stroke volume is the amount of blood ejected by one ventricle in one beat. Cardiac output is the volume ejected in 1 minute. Control of stroke volume and heart rate are continually adjusted by the body and are affected by the return of blood from the tissues. Extrinsic control of heart rate is a more powerful way of controlling cardiac output than changing the stroke volume. Increased central venous pressure causes stretching of the right atrial muscle, which stimulates the sympathetic nervous system and increases heart rate. Stretch baroreceptors in the aorta and carotid detect a decrease in pressure, which stimulates the sympathetic nervous system and heart rate to increase to ensure adequate blood supply to the heart and the brain. If increased pressure is detected, then the parasympathetic nervous system is stimulated and heart rate is slowed, think of the vagus nerve, and prevents excess arterial pressure, which can damage organs. Looking at the pathophysiology steps. In an acute situation, it's an emergency in which a patient is completely asymptomatic before the onset of heart failure. This is seen in acute injuries such as an MI. Chronic is long-term syndrome in which a patient exhibits symptoms over a long period of time, usually as a result of a pre-existing cardiac condition. Systolic, pumping problems. The inability of the heart to contract to provide enough blood flow forward. Diastolic, which is a filling problem. Inability of the left ventricle to relax normally, resulting in fluid backup into the lungs. Left-sided, inability of the left ventricle to pump enough blood, causing fluid backup into the lungs. Right-sided, inefficient pumping of the right side of the heart, causing fluid buildup in the abdomen, legs, and feet.